Children's Hospital at Erlanger.
And I'm Brooke Williams, another physical therapist at Children's. And right now we are standing in one of the pediatric ICU rooms that you would be staying in after your surgery. Just to kind of orient you to the room, of course, you will be in your bed, and the bed will be able to raise up and down to make transfers more easy. There's a monitor in every room, and from this monitor will be 3 or 4 different lines. One to make sure that's a heart monitor, one that is a pulse oximeter to look at your oxygen levels and your heart rate, and a blood pressure cuff. On the other side of your bed, or it might be on this side depending on how the room's set up, you'll have an IV pole. That'll be where your IV's attached to, where you're getting your medicines from, and also there'll be a pole with your nerve blocks. And anesthesia will take care of those, but they will stay in most of your stay to help with your pain control, and they will be attached to your back, come all the way up to about here on either side, and have 2 little wires that go up to the nerve block.
The transfers that you are about to see on this video are critical to your recovery here at Children's, as well as following your discharge to home. It is very important that you as the patient and whoever will be your caregiver at home take time to practice these in your prehab sessions, as well as any time that you might have at home in your own bed. If these are practiced prior to your surgery, you will be able to be confident, as well as your caregiver will also be able to be confident following your surgery.
Okay, so this is the first time we're going to be doing this transfer, and you're not allowed to use your arms at all, so keep them crossed across your chest just like this, okay? And don't push through them or anything. When we lift you up, you can pull your legs out, kind of in a frog leg position, so that it doesn't pull on your hamstrings. Me and Amanda are going to put our hands on your back. I'm going to put one hand on the small of your back, and one hand under both of your shoulder blades all the way to your other shoulder blade. Amanda's going to put her other arm down here on the small of your back, and her arm closest to your head underneath your head. We're going to lift you on the count of 3, keeping our back straight and our legs bent, okay? And lifting with our legs. 1, 2, 3.
Okay. 2, 3. There you go. Before we transfer into sitting, you're going to move your legs to a frog leg position. I'm going to place one hand at your low back and another hand under your shoulder blade, and I'll slide upwards. When we have our hands in position and your hands are crossed across your chest, I'll count to 3. You'll tuck your chin on 2, and we'll sit up on 3. You ready? Okay. All right, keep those arms crossed. 1, 2, 3. Keep your arms crossed. 1, 2, 3. Good job. So, before you allow your caregiver to perform a one-person bear hug transfer, make sure that they get you close to the edge of the bed. They can use a draw sheet to do that on your bed once you get home. With this transfer, you also will need to keep your arms across your chest so that you don't push through them, and you can also leave your legs in the frog leg position either before you transfer or during the transfer. With this transfer, my left hand will be under the small of your back. My right hand nearest to me will be under your shoulder blade, and we'll slide up again to avoid those catheters while they're still in. Are you ready? Okay, you are going to control your neck this time, so we're going to lift on 3. Keep those arms crossed. 1, 2, 3. 1, 2, 3. Good job.
This part is for the body mechanics of the parents or guardians who are performing the transfers. If you see Amanda's back, it is nice and straight. Make sure you keep your back straight and in as neutral of alignment as possible. You also want to be as close to the patient as possible. If you are performing a one-person transfer, you can use the draw sheet to slide them closer to the edge of the bed, and this will make the overall load less. Also, use your legs to lift the patient. So start in a squatting position, and then you can push up through your legs and shift your weight to lift the patient. The next thing we're going to talk about are mobility limitations and restriction for the patient who just had surgery. The bar is attached in the muscles underneath your arms, and therefore you are not allowed to push or pull with your arms in effort to make sure you do not move the bar. It's best to keep your arms crossed across your chest to avoid accidentally pushing or pulling through your arms. You can hold your arms out at a 90-degree angle, or zombie level as I like to call it, but you cannot raise your shoulders above that level. If you can maintain that level and brush your teeth, scratch your face, wash your hair, then that's okay. But if you raise above that 90-degree level, then ask for help. Also, do not bend or flex your trunk forward or twist or rotate through your trunk. You want to maintain military posture with your back as straight as possible. While you're in bed, keep the bed flat and lie only on your back. No side sleeping or stomach sleeping, and also no pillow.